It's 8 a.m. from Fox 35. This is Good Day Orlando.
New research shows that high stress when you're trying to get pregnant can actually decrease your odds of getting pregnant by more than 40%.
We've got a doctor in the house explaining those new findings coming up right ahead.
All right, ladies and gents, too, if you are trying to get pregnant, keep the stress to a minimum. New research finds that high levels of stress around the time that a woman ovulates decreases the odds of pregnancy by more than 40%. Those are huge numbers. And joining us this morning, as he often does, is our good friend, Dr. Jamin Brahmbhatt. Always great to see you, Doc. How are you?
Baby?
By the way, kudos to Dr. Brahmbhatt, who was voted #1 as most influential in Healthy Living magazine.
Thank you.
Right? How awesome is that?
Thank you for all the support,
nice.
Central Florida.
Good picture, too, by the way. Right? Good to see you. So let's talk about this, because we know stress is a real thing in our lives, whether you're pregnant, not pregnant, trying to get pregnant. We all deal with it. Why does it have such a huge impact on us getting pregnant?
This was actually a really interesting study. They looked at over 400 women under 40 that were sexually active. They monitored their menstrual cycles, their sexual practices, and their social habits, smoking, drinking, partying, and other stressors in their lives. And they asked them to gauge their overall stress. And what they found, if you look at it month to month to month, women were 40% less likely to get pregnant on the months they said that were the most stressful. So we all know stress is unhealthy. As physicians, we always tell our patients, you got to try to release that stress as best you can. And in this case, even though it's a female study, obviously 50% of that stress could also be the male partner as well. So there's so many different factors that could have led to this, but you got to find a way to reduce that stress, and I think that's the most important thing.
What do you suggest? What do you tell patients when they're really feeling stressed out? What is the best way to get rid of it?
Well, the best way, I would say, #1 is communication with your partner. When I talk about male-related stress factors as well, a stress in a male can affect their sperm count and their sperm motility and the overall how good their sperm are. And it's the same thing with ovulation cycles in women. So when you put both stress factors together, you're going to get that reduction in fertility. But communicate with your partner, eat healthy, exercise, and I would say find people that are going through the same thing as you. And what I always tell my patients is that, a lot of people go through fertility issues. Almost 15% of people after a year are still having issues with fertility, and majority of them are going to be able to become parents either with assisted reproduction or some kind of help. So it's not the end of the world. So don't get stressed out about it. Help is out there.
All right. It's all good advice. And the other thing that we know is oftentimes the longer it takes to get pregnant, the more stressed out you get. So you really have to dial it back as best you can.
You do. And when you get stressed, people start eating, people stop exercising, and people start getting angry. So these are all things that you need to be cognizant of, because that's definitely affecting you internally and can affect your fertility potential as well.
Doc, how can our viewers find you?
You can find us on pureclinic.com.
All right. And again, congratulations. Healthy Living #1.
Thanks.
Great to see you, Doc, always.
Thank you.